Talk about Sculptra. The cool thing about Sculptra is that anywhere there is skin, it can regrow new skin. So we basically put it pretty much in chest, certainly in face because it's going to do that. Arms, because here in Palm Beach everybody has an issue with wearing sleeveless clothes, especially during season, and the arms tend to get crepey and lose a lot of that fat underneath it, so that's why it ends up getting crepey. But we can also do it in the knees, we can do it in the inner thighs, we can do it in cellulite, and we can lift the butt with it. But here we're just going to do the arms because we're going to see how the arms do end up getting crepey as we're moving along. And the reason why we're doing this is so you can see how easy it is. It really is a very easy injection, and it's an easy thing to do, and it's not very painful. It's a little bit uncomfortable in the very, very beginning, but it really doesn't last that way. So what we're just going to do is grow some new skin here in the inner arm, which is where the crepiness tends to show up. Bend your arm a little bit, sweetheart. And you can see where that crepiness shows up, so we're going to do it from here up to here. Okay, go straight again. And it looks like it might be a little bit painful, but it honestly isn't. It's just a real easy thing underneath in that little fat layer that is still remaining, which is not much, which is why we get the crepiness. We're just going to start here, taste it, and go right underneath the skin, and go in this way, and that way. So we're just in that fat layer, and it's a real easy push. That's why we get stuck. And go back in there. So I put a little lidocaine in it so that it's not uncomfortable at all. How are you doing, Em?
Excellent.
Use kind of a long needle so that we don't have to do too many sticks. This one just a little bit. There's one down. So we use one vial on each side. What it is polylactic acid, and what that does is it stimulates the growth of new collagen, basically anywhere it's put. So we want to put it in the right area, but this is one of the areas that it is very efficient in. Anne here has had it before in the face. We've all had it in the face actually. And we have used it to pull up the neck a little bit. It's done a great job there. And the final syringe over on this side. The reason why it looks like it's a lot of injection, even though it really isn't, is because we use a dilute concentration, so we're not doing too much in one spot, so we grow nice and evenly, and that's the idea. And as you can see, we're missing all the vessels, so we're not getting any nastiness. But we're going to go right up under here because this area tends to show a lot of that crepiness. So once we're up here, she grows the new collagen, it'll be nice and firm skin, like we used to have a couple years ago. Okay. All right, now Anne is going to massage this area 5 times a day for 5 days. And what that's going to do is as she absorbs that sterile water, it's going to help those particles to evenly disperse. And then she will grow evenly. And that's that. Okay.